Depression, also known as major depressive disorder, is a common and serious mental health condition that negatively affects how a person feels, thinks, behaves, and handles daily activities. It is characterized by persistent sadness, loss of interest in previously enjoyed activities, also known as anhedonia, and a range of emotional and physical problems that impair daily functioning. The individuals with depression may experience a variety of symptoms, including fatigue, changes in appetite, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. These symptoms must persist for at least 2 weeks and represent a change from previous functioning to meet the clinical criteria for diagnosis. Depression can affect anyone, regardless of age, gender, or background, and is influenced by genetic, biological, environmental, and psychological factors. It's important to note that depression is not simply sadness or weakness. Rather, it is a legitimate medical condition that often requires treatment, including psychotherapy, medication, hospitalization, or a combination of all. Depression in the Australian context. Depression is a significant public health issue in Australia, affecting a large portion of the population across various age and demographic groups. According to the Australian Bureau of Statistics National Study of Mental Health and Wellbeing, approximately 21.5% of Australians aged 16 to 85 had a mental health disorder in the previous 12 months. Of that 21.5%, approximately 7.5% experienced an affective disorder, which includes depression, in the 12 months prior to the survey. Depressive disorders contributed 3.1% of the total burden of disease in Australia in 2024, according to the Australian Burden of Disease Study. Demographic breakdown. So age, younger Australians are particularly at risk of depression. The prevalence of mental disorders among those aged 16 to 24 was 38.8%. Young people reported elevated levels of psychological distress, with depressive symptoms being common among adolescents and young adults. Gender. Women are more likely than men to experience depression. In the ABS survey, females had higher rates of affective disorders and were more likely to seek professional help. 51.1% of women with a mental health disorder access support, compared to 36.4% of men. Socioeconomic status. Individuals with lower income levels, insecure housing, or unemployment are at a greater risk of experiencing depression. The 2023 ABS study found that people living in unstable conditions had higher rates of affective disorders. First Nations Australians. While the 2020 to 2022 ABS survey excluded discrete Aboriginal and Torres Strait Islander communities, prior studies have consistently shown that First Nations Australians experience higher rates of depression compared to non-Indigenous Australians. Risk factors of depression. Depression is a complex mental health condition that arises from an interaction of biological, psychological, and social factors. For example, genetic and biological factors. A family history of depression increases an individual's risk. Research shows that individuals with a first-degree relative, like a parent or sibling, who has depression are 2 to 3 times more likely to develop the condition themselves. Neurochemical imbalances, particularly involving serotonin, norepinephrine, and dopamine, are also associated with depression. Psychological factors. Certain personality traits and cognitive styles, such as low self-esteem or high self-criticism, can increase vulnerability to depression. Individuals who have experienced early life trauma, such as childhood trauma, neglect, or loss, are also at a higher risk. Environmental and social factors. Stressful life events are well-known triggers of depression. Chronic stress, including work-related stress or caregiving responsibilities, can also lead to the onset of depressive symptoms. Substance use. There is a strong link between alcohol and drug misuse and depression. Substance abuse can both trigger and exacerbate depressive symptoms, creating a vigorous cycle of poor mental health and increased substance use. Gender and hormonal factors. Women are nearly twice as likely to experience depression as men, possibly due to hormonal fluctuations and higher exposure to gender-based violence and social disadvantage. Socioeconomic disadvantage. People living in low-income or disadvantaged neighborhoods are at higher risk of depression. This is due to factors like unemployment, housing stress, and lack of community resources. Treatment options for depression. Cognitive behavioral therapy, CBT, is a widely used evidence-based psychological treatment specifically effective for depression. It addresses the relationship between thoughts, feelings, and behaviors to help identify and change negative thought patterns and behaviors that contribute to depression. The pros: it's highly effective, especially for mild to moderate depression. It teaches practical coping skills and it has long-term benefits and reduces relapse. The cons: it requires time and active participation. The individual must be open and honest about their feelings for it to be effective, and it may not be enough on its own for severe depression. Interpersonal therapy, IPT, is a structured psychotherapy originally developed to aid in the treatment of depression. It focuses on improving interpersonal relationships and social functioning, which are often affected by or contribute to depression. So the pros: it's effective for people whose depression is linked to relationship issues or grief. IPT has strong research support, especially for moderate to severe depression, and it's short-term and structured. The cons: it's less effective for people whose depression is unrelated to interpersonal issues, and it requires time and active participation. The individual needs to engage and communicate with the therapist for the full potential. Medication or antidepressants. SSRIs, the selective serotonin reuptake inhibitors, they work by increasing the level of serotonin, a neurotransmitter in the brain. This is believed to improve mood and reduce symptoms of depression. SNRIs, the serotonin norepinephrine reuptake inhibitors, they increase the levels of two key neurotransmitters in the brain, serotonin and norepinephrine. This helps to improve mood, alertness, and pain perception. The pros of antidepressants: they're often effective for moderate to severe depression by improving mood, energy, sleep, and overall functioning. They can be chosen based on the side effect profile, coexisting conditions, and patient preferences. They're useful in treatment-resistant cases where combined with other medications or therapy. Quick symptom relief, usually within 4 to 6 weeks, and long-term use can help prevent relapse or reoccurrence of depressive episodes. The cons: there are a number of side effects, including nausea, weight gain, sexual dysfunction, insomnia, dry mouth, and fatigue. Abrupt stopping can cause withdrawal symptoms like dizziness, irritability, flu-like symptoms, and sensory disturbances. Especially in children, adolescents, and young adults, there is a small increased risk of suicidal ideation early in treatment. They may require trial and error to find the right medication and dose. Electroconvulsive therapy is a medical procedure that uses a controlled electrical current to trigger a brief seizure in an individual under general anesthesia and with a muscle relaxant. It's used for severe or treatment-resistant depression. Moderate ECT is a safe, effective, and highly regulated medical procedure, often used when other treatments have failed or when a rapid response is needed. The pros of ECT: it has a 70 to 90% success rate in severe depression, especially when medication has failed. It's fast-acting, usually between 1 to 2 weeks, valuable when a rapid response like suicidal patients. Often effective when medications or therapies have failed. One of the few effective treatments that can be safely used in pregnancy. The cons: side effects such as short memory loss or retrograde amnesia, usually short-term but can be persistent. Relapse is possible. Many individuals need continuation therapy or maintenance ECT. It requires specialized facilities, trained staff, and a hospital setting, which can be expensive. Trauma and its link to depression. Trauma, especially early life or childhood trauma, has been consistently linked to the onset, severity, and chronicity of depression. The relationship is mediated through biological, psychological, and social pathways, many of which persist long after the trauma has occurred. Childhood trauma. A meta-analysis by Nelson found that childhood trauma increases the risk of adult depression by 2.7%, with more severe and persistent depression over a 6-year follow-up. The Adverse Childhood Experience study states that each additional traumatic childhood experience like abuse and neglect can increase the risk of depressive disorders in adulthood. Biological mechanisms of trauma-related depression. Experiences of trauma dysregulate the hypothalamic pituitary adrenal axis, therefore increasing cortisol release during stress. Over time, this leads to blunted cortisol response and glucocorticoid resistance, contributing to depressive symptoms such as fatigue and anhedonia and poorer antidepressant response. Childhood trauma is linked to chronic low-grade inflammation with elevated cytokinins like IL-6 and CRP, both implicated in depression pathophysiology.